Good morning, everyone. Good morning from Research Cell, King Gerorge Medical University. I welcome you all to this webinar on how to write and publish a paper. And I see the participants from India and abroad. Morning to the people who are from a different time zone, and good afternoon to participants from India. I request all of you to mute your microphone. Before I start inviting Professor Renner, let me introduce Professor Renner. Professor Renner is a very senior editor of Psychiatry. He was the editor in European Psychiatry for quite a long time. Now he's the Professor of Psychiatry and Editor-in-Chief of Global Psychiatric Archives. He's also the founder member of Global Psychiatric Association. He's doing a lot of research and he has a vast experience in editorial responsibilities. As a reviewer, he has a lot of experience, and he's also having a very huge number of publications with a H index of 67. So, in this presentation, Professor Rainer will be basically addressing the faculty members, residents, researchers about how to write and publish a paper, more of a hypothesis-based approach. We all know that the number of submissions to journals are increasing very exponentially, and the number of good quality journals are relatively less. So the rejection rate is quite high, and unfortunately, many researchers, they go to predatory journals and submit their paper there. So here in this webinar, we'll be talking about how to write and publish a paper in a authentic, credible, good quality journal. Over to you, Professor Renner.
Yeah, thanks for this invite and thanks for the introduction. And I'm quite happy to talk about this issue because I think this is very much to my heart. I like helping people to publish papers, and I regularly edit papers as editor of Global Psychiatry Archives. And I see the common mistakes, which usually are quite frustrating sometimes. So most of the biggest mistakes are not looking at the author's instructions, but I come to that. So I'm from Glasgow at the moment. I work here. One of my favorite hobbies is more or less running the journal Global Psychiatry Archives, and you're very much invited to submit a paper. And I start with now. So you know the story, publish or perish. So the question is, how do you publish and not perish? So the question is, in starting writing a paper, I think it's very important to look at your motivation. What are the resources? What the requirements? What's the message? What's preparation do you have to do? And what are the parts of your paper which are important to you? And the question now is, I don't take this away. What are the hypotheses? And the question is, how can we implement a hypothesis-based approach? You can also call it a question-based approach, or structured approach. So we talk later about the types of papers. We talk about authorship, submissions, resubmission, and proofreading. So let's go to this one after the other. So what's your motivation? Why do you want to write a paper? What do you want to achieve? Some people want to inform the world. Some people want to make an impact, improve your career. Some people want to move to academic work, fame, or change of services. And some people just publish because they want to help the patients and provide something. And I would think that if you do this, you should consider different types of journals. So if you want to help patients in your area, it's much more important that you look for a regional paper than a national or international paper, where your readership, your possible readership, is not reading or not have no access to. Right. Okay. So the other thing which is very important: where do you work? Do you work in a practice or have an outpatients clinic? do you work in a hospital or in general service or specialty service or in management or university? And I would usually say work or publish in relation to that. I had a colleague of mine who was working in Alzheimer's disease genetics, and she then wanted to do something about the quality of life. And this is very difficult because, you know, there's other people. So she found things new and interesting, which had been published already 5-10 years before, or even longer. So I think I would recommend you stay where you are and you know what you're doing. Okay, so what have you got? Do you have cases? Do you have a data set? Have you got a completed study, or is it just an idea? So we're not talking about this idea where you start with an idea and write whatever, put up a study. We're talking here when you have the data. So is it your interest in research? Is it ambition? Do you have a want to write? Some people struggle with writing, and and this is the idea I have here today, or try to present, is if you do a hypothesis-based approach, it's much, much easier, and it will be much more likely you will be able to publish. Right. So there are some requirements which are very important to look at. One is time. If you have to be very clear, if a paper can be written in a week, it has already been done. And I possibly would say if it can be done in a month, it has already been done. But some people might disagree on that. You also need a bit of resilience, you know, because sometimes it can be frustrating. You have to work with other people who don't do what you expect. You know, in collaborations or in international collaborations, you know, everything takes time and can be quite frustrating if you have an idea and it's not answered straight away. It's good to have a secretary and a good relationship to a librarian, because sometimes if you write a systematic review, half of the time or half of the work is possibly related to the fact that you can't, you struggle to see the, sorry for that. I don't know what that is here, sorry. Okay, I made a mistake. I clicked the wrong button and I tried to escape. Sorry for that. I'm trying to get the, I don't know. Okay. Sorry for that. I just pleased to see all the people here, but I don't know the screen. Okay, I'm back to my screen, so that's a bit stressful here. Okay, try to get this out of the way. Okay, so that you need resilience, possibly. That's what I said about that. Okay, you need possibly a secretary. Librarian can be quite frustrating if you don't have access to papers and you have to order them. It's quite nice if someone knows how to do that. Supervision and a coach can be extremely helpful. Who would be the one who looks, who you can discuss problems with? A senior colleague might give advice. And yes, you have to have access to data, access to files, and it helps to have access to a statistician. Very often it's important that it's not just the calculations. We see it very often that people have done calculations. The calculations are there, they're available, but very often people struggle with the fact, and this leads to rejection sometimes, people struggle with the fact that that they can't move, so that they can't express what they have seen in a paper or what they have realized in a paper into a sentence. Right, I have to move forward, and now it's just, I don't know what has happened. Are you can you just feedback whether you see the video here?
The video is not visible.
Say again?
The video is not visible. The video is not visible.
Right, so you can't see me. Okay, I'll try again, and that's possibly one of the problems here. Okay. Right, so that's sorry for that. Okay, I have to cut that together. So, but let me know if there's a problem later. Okay, I don't know. Sometimes these computers do what you want, and this is what it means. Things don't go right all the time. Okay, I hope it works again. So the question is, what is a story? And this is something you should also think about before the starting to write a paper. So what is interesting? What is special? You know, what is special about the specific blood levels in a specific medication? And you should look at what's new. Why would someone want to read the story? And why would someone want to publish it? And why does the world must, or the academic world must know about that? And sometimes it's very easy to think about this is interesting, but then if you look at the literature, then you sometimes can't see the relevance, or the relevance is already been seen by many other people. And then we come with something which we call a Me Too paper. So the question is, why must you make the effort to write it? Okay. So before you even write it, do some literature research, discuss your results or your interesting part with a senior researcher, discuss it with a senior clinician who then can say, is this something new? Is this something interesting? So if you have specific cases, then nobody knows what's interesting. One of my first papers was about the function or the imaging of patients with multiple sclerosis. And I, as a young researcher in the first year of my job, would have never known whether this has been published or not published. And I had to discuss it with my senior clinicians. And then we came up with the idea to publish a paper about galantamine medication in functional imaging in patients with multiple sclerosis to detect fresh and old lesions. So, but this is something I had to discuss with radiologists. We had to discuss it with colleagues. And so then we had to find out what is interesting. Right. So the other question is, what do the other want? So the question is, editors want to have an understandable paper which can be read easily, where they have to the likelihood that this is cited, and this is something reviewers don't, then they might not have the same interest. But the reviewers want something which is clear. They later want clear communication with the author, and the publisher wants to publish as easy as possible. They don't want to go through 15 different versions. So I think the publisher also wants that their journal is be seen as something which provides important information. These things all overlap a little bit, which makes sense. But looking at the reviewers, and this is something which people underestimate, the reviewers want to understand the paper, and they want to read something which is understandable. And if it's not understandable, then it's very, very difficult. Looking at readers, so have different journals, so sometimes like the BMJ, it has if you have the articles, you have occasional readers who usually wouldn't be interested in the whole of the journal, but they might pick up something. You might have subscribers of the journal who dig in and dig out in specific articles, but you also write for co-researchers who do the same thing or similar things, and you want to communicate with them. And in most cases, you communicate them via writing a paper, unless you have a very closer contact. You might have followers on the internet, but most importantly, you write for readers. You have to convince the reader and try a nice story, and you have to write for researchers. So these are the two things which are the most important. Okay, so what papers you can look at? I'm looking today at original papers, but we have guidelines on case reports, systematic reviews, short reports, editorials. Some have rapid communications where the editorial process and the review process is shortcut in the interest of a very good paper. But on the other hand, you have to be very clear and very straightforward what you publish in these circumstances. You have letters to the editor, which can be focused on a recent paper. That's a structure in the BMJ where you have articles, correspondence to the editor, which focuses on what they have published recently. But you have also other letters to the editor, which is like the Lancet or Nature, where people publish short publications of their paper. So you say it's a letter to the editor, but essentially it is a normal paper. And this can be very, very difficult, because you have to write things very, very shortly. So now coming to what's a hypothesis-based approach. Looking at the hypothesis should be, or the hypothesis or the question or the aim of the study should be visible in all parts. The introduction usually develops and states the hypothesis at the end. The methods usually describe how the hypothesis is tested. So you, as an author, you have to write how you test your hypothesis. And this is already what you see very often, that people talk about very important things about whatever. Let's talk about burnout, and they talk about what's burnout is very, very causes problems, and they are underseen or underestimated and undertreated. And then the paper might then be about the gender differences of the effects of burnout on suicide. So then there's no point writing endlessly about one thing. What you have to do is then combine different things. And then you have to describe how the hypothesis is tested. So what do you do to find gender differences? Or the question is, if you look at mental health and pollution, then you have to describe how you measure pollution. And it could be in different ways. It could be by measuring something in the air, or it could be by simply counting the numbers of cars passing by, or looking at the distance to a factory. So I think you have to make clear that what you measure is relevant to the study question, which might be then mental health and pollution. But you have to then explain this properly. Right, then you describe the sample and the results. How have you collected the data? How did it go? Some people have had changes, especially during COVID, which is understandable. And then you have to do the statistical analysis that lead to rejection and that support the hypothesis. So usually you should have methods and calculations which are referring to your study. So if gender differences is important, then there might be, or is it what you really want to look at, then you have to compare different genders, and you have then to look at this, and there's no point looking at correlations and other things. Or if you look at age effects of age, you possibly have to or if you just cluster the age, you have to decide why you do that. So sometimes people very often, when they look at age relation, they put then very often age in groups from 10 to 20 to 30. However, it's not even necessary, because age is something you can easily measure in an interval scale. So I think sometimes you have to look at the data analysis matches the question. Right. So then in the discussion, you should state the confirmation or refusal of the hypothesis. Are there gender differences? Are there no gender differences? Does it make sense what you found? Or if you don't find anything different, is it something that you measured, you had the wrong measurements? That maybe there might be some other influences. So maybe that the passing by cars are not a clear validation of air quality. And this, I come back to that, but just to give the idea, usually the abstract gives 1 to 3 sentences of each section structured in objective, material, and methods. But the point I'm trying to make here, that in all of these parts, you should have an eye on the hypothesis. Right, just do it a little bit more clearly. The introduction leads to the hypothesis paragraph by paragraph. You introduce the disease or the concept, the objective. Usually, I think it's good to have some headings. And so you then introduce the relevance of the disease or the concept. You introduce a connection between the different items, and then you develop and name the hypothesis which is to be tested. So this can usually be done in different paragraphs, and that's how it should be. Right. So the introduction first comes with the background, what's the disease, then you come with one issue in one paragraph, second issue, third issue, and then you have paragraphs which try to combine the issues in the way which makes sense to your question. So that would mean you develop the hypothesis, and very often people don't write, what is the hypothesis? They write, we explore the important relationship between whatever health and or mental health and other things, but what are or pollution. However, they would never say what the stuff they really investigated, and this shouldn't be in the hypothesis. So the hypothesis should be quite clear. The other thing I would say, think paragraph by paragraph, and try to connect them and make sure that the reader is guided properly. Okay. So material and methods, you have usually the usual stuff, that you have the sample, the materials, the collection, how do you collect or recruit the people, what are the controls, what are the methods you use, the statistical ones, how do you process the material, what type of lab analysis you do, what type of interviews, depending on the study, what type of what type of the validity of the methods. So if you use an interview, you should say that this interview is something which measures depression, or it measures some levels of frustration or anything else. Right. What you usually give in detail, or the detail you should give, is usually, can an independent researcher reproduce the study? And does the reader have sufficient data to be convinced about your study? And in the question, you could also think, what did you do to assess your hypothesis? But important thing is, a reader should be convinced, and an independent researcher should be able to reproduce the study, and you have to provide sufficient data for that. Right. So you could also think it's in hypothesis, in the way of hypothesis, when was the hypothesis tested, in which sample was it tested, which were the instruments and the outcome, how were these instruments applied, how is the data analyzed. So people very often come up with saying, okay, we have hundreds of analyses done, but what they very often don't do is saying, to assess the gender differences of, we used Scheismer statistic, which that would be much more helpful than saying, okay, we analyze these data, these hypotheses, and then we just do a little bit of statistics in different ways. And as a reader, you don't know what is connected and how it's connected. Right. The results are usually main findings. Then you come to individual results, hypothesis by hypothesis. Many people or many studies have more than one hypothesis. Results that provide evidence for the quality of the data, looking at additional results, and looking at unexpected results. That's what we should do. Okay, and then, right. So it's important to have a description of the sample or the environment in the results, description of the results of the data analysis related to the data analysis step by step, description of the main results, the results and the relation to the hypothesis, and the question, has the hypothesis been falsified or has it been supported? That's a question you have to ask. And coming to the discussion, more or less, you start with a reiteration of the main findings, hypothesis. So let's say we found the gender differences not to be significant. Very often there's a bit of a mistake, people saying, okay, it's not significant, they didn't find the statistics, but on the other hand, they then explain there's a difference because, you know, there's a minor difference which is non-significant. If you tested for significance of the differences, you should really stick with that. Okay, then you compare with other authors, you compare whether the results are valid, whether your methods are good enough, whether, let's say that way, some people about air quality have found something in different areas or with different methods. And what are the meaning of the results? What are the study limitations and what are the conclusions? So the conclusions is very often that people make this mistake and say, oh, we find something very important and, you know, now we have to have psychotherapy about that. If psychotherapy was never examined, you know, like, you know, you find something about, let's say, burnout, then you should look about what's about your burnout. What have you found in your study? So there's no point saying, okay, psychotherapy would be nice, and then talking about the psychotherapy. What have to be done is that you discuss the results. Okay, so the discussion, and this is the last reiteration of what I want to say. You state the confirmation or refusal of the hypothesis. You see whether the hypothesis was valid or is a valid outcome. How does it fit with other publication? What does it mean in general and especially? Where are the limitations of the data analysis and how can this be used for future research? So it should be then that people think about what is this specific, let's say, finding about burnout, gender differences can be used. So it can be used to detection, but it's not that you can say, okay, now we have to have psychotherapy for everybody. That's not something you have been looking at. Okay, so the abstract, I said this already, and you give 1 to 3 sentences of each section structured in objective, material, and methods. The objective, develop and state the hypothesis. The methods describe how the hypothesis is tested. Results describe the data collection and analysis that lead to the rejection or support of the hypothesis. And the conclusion states the hypothesis and refusal if B, and validates it and explore the practical aspects for future research. And I don't know why this is not working. Okay. So the question you can choose very simply, what's the relevance of the question? How, that's the introduction. How to answer the question, that's the message. What is the answer to the question? That's the result. And what's the relevance of the answer? And we published this already in the Global Psychiatry. If you want to have a look, Global Psychiatry Archives. If you want to have a look, you can read this up. Okay, so we have also other guidance. So other guidance for other types of papers. So usually I would say you can also use this hypothesis-based approach for case reports or letters to the editor. But I also would say there are other people who have come up with more precise or more detailed ideas. So it's the JBI Institute, the Joanna Briggs Institute, and there's for systematic reviews, which are very, very appreciated by journals. There are Prisma criteria, AMSTA, or also from this Joanna Briggs Institute from Australia. Editorials and global perspectives sometimes have less systematic recommendation, but so they also have something usually in the author's instructions, and I can also always recommend check the author's instructions and adhere to them. Okay, so I would like, is there any question? Sorry. No. Okay, just let's then go on. So here we have some, let's say that. Say again? Say again? Yeah, I know. Okay, so there's we have some, these are from the Prisma criteria where you have abstract introduction methods, and you know they're very very clear about individual findings. Usually, I think it's possible to follow this approach, but it's also possible to follow this approach and just not trying to link that. The idea is of this hypothesis-based approach that you're trying to link things together. But on the other hand, you know, in these introduction, they come up with the idea, have the rationale of the study, provide a statement of the questions precisely, and then of your interventions. What are your interventions? And they use these PICOS criteria. What is participant interventions, comparisons, outcome, and study design. And you know the question is then you have to give information about how you analyze the data. So it's more or less it comes with the same, let's say, the same territory that I would say, you know, explain your hypothesis that someone else can follow it. Well, you can also say these are the individual things which are in the paper. And I would really recommend to if you want to do a systematic review, which is very welcome, to follow these criteria. Sometimes what people then do is just that they write about these issues, but don't link them together. I don't want to, for time reasons, I won't want to go through this. That's the other thing. So let's say it that way. These PRISMA criteria go into much bigger details. They write how the studies in this respect for systematic were reviewed in the results. For each studies, then you should look at characteristics, usually in a table, and then you look at the bias, you look at the individual studies, and then it's most important, which is very often forgotten, how do you synthesize results from different studies? Interestingly, sometimes the interesting part is not even in the papers. So it could be very much, and we have seen this, that when I looked at a systematic review about OCD and suicide, that interestingly, there wasn't even any. So we had quite a lot of studies, and you could see that the OCD. Sorry? Okay, I don't know, maybe. I don't know whether this was a comment or I don't know. Okay, so the question very often is whether these things are properly connected and whether this stuff is understandable. Right. Okay, so now we come to another question. So what is the authorship? So who should be the one who is an author? And I would recommend that, and this is a bit of a tricky one, just to wake you up. There's one issue which certainly shouldn't be justifying an authorship. So the question is certainly if you develop the study, that should qualify for authorships, drafting of the paper, writing of the paper, providing important information or data for the paper when people have been thinking about that. This can be very tricky in some cases when you provide genetic information. Did you really think about the paper, or is it something that you is maybe not related, and you just provide something which might help the author having control samples? And sometimes it's if the paper is not written in collaboration with these people who provide a control sample, then it should be in the acknowledgement. Certainly sponsorship doesn't belong into authorship. It belongs to the acknowledgement and in the declarations. So provision of data can be very important. Provision of samples, help with the data analysis, and help with correction and proofreading. So some is paper related, some is study related. Usually, most journals would expect that people who are authors have very well contributed to individual papers and have contributed substantially to the development of the study, to the collection of data, and also eventually in writing the paper. So just looking eventually at the end of the paper and just proofreading is not enough. So people should be involved, and this is something where authors make a little bit of a mistake. They don't involve they don't involve their co-authors in different aspects, in correction, proofreading, or in all aspects of writing. So I would really recommend that people should involve their co-authors, and these co-authors should take it serious. And sadly, it's very, very often that co-authors are very busy people, and they just selected for being able to support, that people, that editors might be impressed by the name and publish a paper, but that's not what it's all about. Usually, authors should be involved in all aspects of the study and should make a substantial contribution. And if the statistics is something which is very simple and easy, you can justify this to put it in the acknowledgement. But if it's really a major issue on your study, then I would recommend that this is something which also might provide the qualification for authorship. Right. So the question now is where to submit, and so now we're coming to publishing, where to submit, and what type of journal to choose. I mentioned before that, if you have something which is regionally interesting, setup of new services, then it should be a regional journal. Or if it's something which just refers to, let's say, suicide attempts in Uttar Pradesh, then it's possibly a national question. And because maybe if you go for an international paper, you should ask you whether a Greek reader or Chinese reader or a South American reader is profiting from something. So let's say that way, we have very often people who say, oh, I set up a service for blind people or for blind people in a specific area, and I would like to describe the service. So that's possibly something, if it's something which is, completely groundbreaking, that's fine. But if it's something which is not really something completely new, then you might ask yourself, why would an international paper journal accept that? Sometimes you have very specific subjects, journals who are specific, or, it's like a journal of whatever, suicide research, or journal of anxiety disorders, or you have something like very general, like our journal, Global Psychiatry Archives. Some journals have specific objectives, not just, they want to focus on something. Let's say Acta Scandinavica, Acta Psychiatrica Scandinavica initially focused a bit about their area, but then they just became a more international journal, and you have to look at the readership. So who are the readers? So if you just want something which is, let's say, treatment-based and service-based or service development-based, you're better off in a journal which has a very readership, which is not just in science, but also in administration. Right, so the question also is the impact of the journal, and what have they published previously? Have they looked at something which is interested? Are they interested in something? And some journals, sometimes they have a little bit of an interest for something, and then after a while, they lose their interest, and then they go for something else. Right. When you do a paper and when you submit a paper, you should really complete all parts of it. And this is the most frustrating things for editors, where things are missing, abstracts are missing, or some slides are missing, or the slides, or some figures are in the, or sometimes I would say in the development stage. And so everything should be there, cover page with authors. Sometimes affiliations are missing, and then people come up in the print or in the galley proof and say, oh, my authors or my name is not written properly. So you should do this properly at the beginning. Do an abstract, do introduction, material, methods, results, discussion. That's a standard. Put your references in, put the acknowledgement and declaration of the interest or other declarations in the place where the author's instructions want that. So that's the most important. Follow the author's instructions. Right. Before you submit, again, double check the author's instruction, write a nice letter to the editor, and in the letter to the editor, just put in and say, okay, this is important because this paper refers to something, whatever, environmental problems, mental health, or gender differences, and you should then mention what the editor or the readers can learn from it. So some people say, okay, this has never been done in Iraq or Iran. Possibly that's not the greatest of all ideas. People, especially if you have a journal which has a wider spectrum. Look at the format properly, look at all the forms, and check with all your co-authors. Sometimes co-authors are difficult to get, but they have to be more active, and I think that's possibly the future, that we can't let co-authors go away with just putting their name on something. Right, look at the declarations. Two things which are always important are ethical approval, informed consent. People very often don't understand that you even have, if there's no ethical question because it's a systematic review, then you have to say that, because the author or the editor and the reviewer, they do not know that, so you have to tell them. So it might be evidence, it might be important for you, but let's say Scopus and PubMed, they require very clearly that all the declarations are given. Right. Then if you've all done, you click wait and see. Previously, when I was younger, we had to look at the author's instructions and provide a little 5 copies or maybe up to 7 copies or 6 copies of the paper sent to the author, whatever miles away to another country, and that costs money and it costs time. Now it's just a click, and then you wait and see. And usually the duration is the same. It usually takes a couple of months for getting an answer, because the author and the editor has then to look for finding a co-editor or someone from the editorial board. And then you might be lucky to get an acceptance, minor revision, major revision, or rejection. Rejection, that's a bit frustrating. Say usually you wouldn't get a rejection, but on the other hand, we can look at what are usually the reasons for rejection. I think I need another 5 minutes and then should be fine. Okay, so reasons for rejection. I mentioned quite a few already, but the most important point might be nothing really new. So maybe it's new to you, but has been done in other countries hundreds of times. That's not really the greatest of all things. It might be not relevant, or the scientific interest might be very local, or might be not there at all. Very often the evidence is not totally clear. So let's say it that way, the findings were not consistent with what you wanted to achieve. But then again, I would say you can, if you are clear and have your idea and your message clear, then you should be able to write something about anything, even though if it's a negative finding. You don't have to squeeze a positive finding or something. Even a negative finding is relevant if it's properly proven and substantiated. Very often people don't get to the point, and that's when the reviewer gets confused and doesn't know what really is the story. So very often authors think that the reader can make his own conclusions, and they don't expressively write things down. Sometimes the methods are unclear, poor or too much statistics, too much irrelevant stuff. So they don't focus on what's the hypothesis. Tables are poorly understandable. So very often people think that the person should, or the reader should, go through all the parts of the paper and memorize 20 issues and abbreviations to look at the table. So usually, if you have a table, the table must be understandable without looking into the paper, and the abbreviations should be there. One thing you very often see, and this is where the message doesn't come through, when the introduction, the methods, results, and discussions do not align. And the discussion doesn't focus on the results or something else. And very often the conclusions cannot be substantiated. Okay, so what do you do then if you're rejected? Usually if you have done a decent study, sometimes it's more or less you haven't window dressed properly. So I would say very often people do nothing and get depressed. That's certainly not the best option. Accept that you have been rejected and deal with the critique. You might try to understand what the editors mean, try to improve your paper. You might complain, which I've done once, and about transcranial Doppler and in Alzheimer's, and the reviewer had no clue. Then I could say the reviewer had no idea. So you can complain from time to time, but it doesn't always work. But usually you should learn from that, and you should take the learning, or let's say the critique you have, improve the paper, and then resubmit. So some people say, oh, just send it to someone else. That's not what you want to do. Right, you have to, if you have some chance to resubmit or major or minor reviews, then you check the editor's decision, check the reviews, and this is why people very often make mistakes. They do not prepare a proper response to the editor or the reviewers, and they don't provide point-by-point answers. And so this can be very frustrating for the reviewer. They then have to look at the old paper, the new paper, and their comments, and that can be very difficult. So it's reviewers and editors really appreciate point-by-point answers. So when people just say, oh, we rewritten your paper according to your questions, and now it's better, that's sometimes very frustrating for reviewers, because they want to see whether their points have been addressed, and they don't have the chance. They don't know the paper as much as you do. They have to read it and try to make sense out of that. So think about the work and of the reviewer and make it easy for them, and then very often it's much, much easier. Sometimes, you have to go a little bit further than when you have something, you have to, let's say, gender issues, were part of it, or you find something, then you might have to change your paper a little bit, or if you had an interpretation on whatever minor findings, might be a problem then. Okay, proofreading, last chance, no correction possible for centuries. Any mistake, your fault. If you have questions, if you have questions to the authors, clarify of your corrections and make it clear. Usually the printer has no clue what you're talking about. He might whatever, do things about phishing and psychotherapy or anesthesia. So you have to tell him what words he put where, and it's not just, write something proper or change the name of something. It's saying on this line you have to write this, or it's standing this line, and this is what it is, and it should be different. Okay. I've been asked to comment on artificial intelligence. Usually, it's very difficult at the moment. It's under development. We had a paper which more or less was very, very nice English, but it was repeated from the introduction to the discussion, and even a copy. The paper was copying more or less tables from other articles. Artificial intelligence often do that, so that's a problem. So you have to go through with that. You have to be honest about that. And if you use support software for literature management, no problem whatsoever. If you use support software for managing articles, no problem about that. But be honest, check the author's instructions and put it in the declaration. The interesting part, you should, people very often submit things which are in different formats and PDF files. This is usually what comes out of that. Usually papers are simple PDF and HTML files, and they don't have fancy stuff, and you can't expect the the printer to change from fancy picture presentations to PDFs and HTML files. You have to do it as the author. Right. Final take-home message: if you still have resilience enough after that talk, so you consider publishing in Global Psychiatry Association. Thanks for your interest, and the next one gives you the links. Thanks a lot.
Thank you so much, Rainer. We have some questions from the audience. One question is, am I audible?
Yeah, it's a bit of an echo, but I don't know what it is.
Can switch on this. Am I audible?
Yeah, you're audible, so I can hear you.
Yeah. The first question is from an ethical point of view. If the invited person for authoring did not respond, how long one should wait for before removing that person? This was asked by one of the participants. More of it is related to inviting an author to contribute to an article, and that author agreed for that. Then didn't respond subsequently. So how long one should wait? So it's more of
So the question is, all of these things is a bit of a question of how long is a string of whatever piece of string. The question is certainly different for different areas. I think I wouldn't, let's say it that way. If you have something like genetics, where there's lots of competition on that, you possibly don't have the time for waiting something like that. So I think it depends very much on how you can justify that. I think it makes sense to wait a bit, but I think, yes, we have co-authors who don't respond at all. We sometimes, we usually would say, I think there is some guidance on, that's another issue, a guidance that papers should be managed within 3-4 months. But so in this respect, if we wait much longer, then we struggle. However, if it's a good paper and we don't have too many papers and we can wait, and let's say it that way, some people, we had authors who were working with NGOs in displacement camps. So then you struggle a little bit. I think, then I would say, okay, wait a little bit longer. This person has some whatever struggle to do and has hard work, and life isn't, let's say, if they work in a war zone or something like that, it's also a difficult issue. So I would say reasonable is usually waiting for 3 months for a review. I think most people, let's be honest, I think it's getting harder and harder, I would say, to the authors. If you don't correct it straight away, it's getting harder and harder. But the other thing is, we also get very often other people who publish something similar, and then if something is not published within a year or so, I think it's not worth it, So I think I would say from the side of the editors, we should wait a couple of months if we can do so. But if that's for the corrections. And if you have communication within your team and some of the authors don't answer, I would simply give them a warning and say, okay, if you don't answer, we need to publish this paper within this time frame, and please answer. And I tell you something: if you threaten people a little bit like that you have to take them off with the guidelines from the journal, or that they need to have the support, then they have to go. I would say, but be reasonable. I think some people are, let's say it that way, if they're just on a trip, or I think some people, if it's archaeology and you have a trip to whatever, a site where email doesn't work, then it's a problem. But if people doesn't answer 3 emails, and then I would say, I think it's ethical to take them off. The requirement is usually that authors or co-authors should be involved in all parts of the journal and all parts. And I think I will possibly push this more and more in the near future, because what we see more and more is that the first author is sometimes not the most or the best of writing a paper. They struggle a little bit, and then they struggle with the editor. And I think the knowledge should be within the team as well to make decent corrections. So I think there is no clear answer. I think be reasonable, but I think if people don't answer within your team, I think that's they shouldn't be authors. We had a very frustrating experience recently where we had a fully set paper and the author would not answer. So we made the decision that, at the end of the day, it was already in the galley proof, and I had to go through this myself then. But I think that can be very, very difficult. But I think, I think no clear answer, but I think be reasonable in dealing with your.
So it totally depends upon the context and response of the author. We can give a reasonable time, up to 3 months. We can, considering the situation of the authors.
Yeah.
And totally depends upon the journal guidelines, journal policy related to that.
Yeah, sure.
One more question that is related to a participant asked, novelty of the research question cannot be achieved for the huge number of relative literature on the international level. There may be huge amount of literature in international level, but may not be any study in a particular country or a particular region. So should we consider that as a novel research for that country? So I think you have already covered it in your subsequent presentation. That is Me Too publication. That is already amount of research is there, and plenty of evidences are there. But in a particular region, that research was not being carried out. So
Yeah,
should we consider this?
Yeah, I think I understand the question. I think it's very difficult. We have this very often, that specific suicide research wasn't performed in Hungary, or we haven't done it in this country. I think possibly it might be helpful if the authors would think, yes, we do this, we repeat something, but maybe instead of just saying, okay, it hasn't been done in our countries, just think why it might still be valid for international readers. So if you can say, okay, there is lots of variation in whatever suicide attempts, and there's differences in suicide attempts, and we would possibly say, okay, there might be some difference, even if you don't find any, but it might be so that we want to learn from our countries, from our culture, or you could then argue that suicide attempts are depending on the culture, the life environment, and so on. So if you make it so even in these circumstances, I would say try to make it interesting why a reader should read that. So if you say, okay, we have done it in Doha, but we haven't done it in whatever in Dubai, and that's possibly something where you say, okay, so what's the point? But if you can just argue, and this is why I'm sometimes thinking, what is your story? If your story is, I do something others have done in a different country, then nobody is interested. But if you say, we have a specific service, we have a specific country, we want to know whether this is different in other countries. Do we learn from this country, from our country as well, or is it necessary that instead of transferring data, is it safe enough to transfer that data from other countries to our country? But then again, you possibly might be better off if you can't argue this point, if you can't argue the point that it might be relevant also for other countries to know that there is a different culture, there is a different way of dealing with suicide. We have countries where it's forbidden. We have countries where it's different religion. So I'm trying to say, I just take the example of suicide in this case. I think you can justify this certainly, and I think you can but you should try to justify this. Very, very often, and this is what I would like to say, it depends a little bit. Can you tell a story? And the question is, this is where you possibly have to talk with senior colleagues who know what a story is, yeah? So who know what might be important. And I think that's, and if it's something, you know, it hasn't, let's say in that way, it hasn't been done in Uttar Pradesh, and, you know, it hasn't been done in around New Delhi or something like that. That might not be interesting. But if you focus on saying, okay, there might be differences, is it the same? Is it depending on our social construct? So, or is this whatever schizophrenia? That's very often, we had studies about multiple sclerosis where the epidemiology was very, very important. And what you could see that hotter countries had slightly different rates of multiple sclerosis. So that gives some idea about the pathogen or something like that. So if you can argue on that, do it, and then make it interesting. But just saying, okay, we haven't done it in this country. And this is why I would say you have to lead the reader. So if the reader knows now, okay, there might be some cultural differences, that might be interesting. And then he might be interested about the fact that that there is something specific in this country, or, you know, is it just the same? So let's say schizophrenia, take the example of schizophrenia. There are epidemiological little differences from country to country, which means possibly it's not infectious. Yeah, if you have if infections go by, let's say, by country, or they have outbreaks. So if you just have a very, let's say in that way, there might be some other factors. So let's say that way, if you want to do something, you could refer to culture. And this is where I think a story or a hypothesis, a red thread, we call it in Germany, so is important. Make it a story and try to think, what is the story about? And if, let's say, if you're the 200th country, then you can say, okay, let's say that way, Tuvalu is a very small country. We would like to know whether we have completely different social construct, social area. We live in different areas. We're more isolated. Does suicide look different? And I think that's where you think it's very important to tell a story and make it a story.
Yeah, thank you so much. We have another question from Dr. M1 Christian from Cameroon. His question is with respect to how to choose a journal. So selection of journal is a dilemma. How to choose a journal?
Right. I think, to be honest, you know, I think usually we all want to publish in Nature or Nature Genetics or something like that. So you have to see, I would possibly, and to be honest, when I was younger, I always thought, you know, I publish in a paper I've never published before. But on the other hand, sometimes it's also easy to oversee that journals are different. If you just say, so let's say it that way, I would possibly look at what the journals are doing. So let's say if you have the British Medical Journal, then they are very much interested in something where GPs are also interested. So you look at the journal. So so you possibly, and this is why I'm thinking it's nice to have a librarian who you can speak to. They very often know that some journals have different focus. Nature always wants to do something about which is groundbreaking. And then you have to think about, is it a regional thing? Regional things can be interesting in the global sense. So something like that, like we had some papers about floodings and mental health. So this is something which might be of interest, not just for this area, but it's the question of how much environmental factors play in the world. And then, you know, we can publish in a journal which is like Global Psychiatry Archives, which I usually recommend anyway, in selfish way. But the other thing is, and this is why we have global and local issues. But the question also, choose something where you think, look at the impact factor, usually look at what have they published, usually see what they're interested. The British Journal of Psychiatry, they're very much into treatment issues. I think they're possibly still still supported by the pharmaceutical company, but they have little. Some journals are very much focused about medication. Some are focused on environmental stuff. There's specific journals like international journals where they look at forensic conditions in different countries. So I think it's I would possibly look at the journals and see whether my article or my idea fits into a specific journal. Is it a global journal? Is it a regional journal? Is my question a regional one? Is it something which is completely new? If it's, let's say, if I have data from Cameroon and it's about Ebola and mental health, it's possibly something which is completely new and nobody else has thought about that. So what is the mental health of, let's say, Ebola care workers? Then you can possibly go a bit higher with the impact factor. But if you have something which is, let's say, that way, you have only a very short, short questionnaires about whatever is about depression or one thing. And then in 15 workers, that might be something which is not interesting. So you see, you should have some idea when you read the literature about your issue, and when you prepare your paper, you should get some idea what others journals publish, what have they published before, which quality of the journal is the journal, and usually. So there's a multitude of factors into this, and it's how much your data are original, completely new, something which is an eye opener. I think my brother once wrote something about that where the cultivation of barley started in the world, and so that's something which wants to know. But if you describe something very simple, and then you should be clear whether it's more administrative, so try to find out, try to get some ideas about the most important journals. And sometimes they will answer you, if you make a mistake, they will answer, this is a subject we are not interested in. So let's say it that way. If you say mental health and flooding is certainly nothing which possibly the Swedish journal, the Acta Psychiatrica Scandinavica, would be interested to publish. But if you said something about cold and mental health and snow and winter and seasonal affective disorder, that's possibly something which might easily fit in there. So journals have a different impact factor. They're not all the same. Then you have Journal of Affective Disorder, and then so they usually sometimes have specific tools they like to do. They have sometimes some details in what they want in their articles. So get an idea, discuss it with your librarian, discuss it with other colleagues, and then discuss it how much worth or how much interest your article could bring. So always, again, think about readers and think about editors and think about what the message might be. I hope this helps.
Thank
But
you.
I think in
Yeah,
these things,
there is another interesting. There is another
yes.
interesting question by Dr. Sai Saran. This is how much helpful are the transfer desk services? Do you recommend them?
What do you mean by transfer desk services?
Because a lot of journals now, when they reject an article, they recommend similar kind of a few more list of journals published by the same publishing house. Suppose LCBR publishing house, you submitted an article, they rejected your article. They suggest four, five more journals published by
All
LCBR
right. Okay.
publishing houses.
Yeah,
Something
I
like
think
that.
that's a bit of a new development. I think it's. I wouldn't. Let's be honest. I think if it's proposed, I think I was involved when we thought about this in European psychiatry. Yes, we said, okay, sometimes it's more or less something which is done for the publisher, because they don't get some papers in one journal and then try to put it to another journal. I think it's not your interest Our interest should be to choose the best one and not saying, okay, I think what could happen is that they just, you want to apply for a decent journal, and then they push it into a journal which more or less is there for parking articles of lower quality and don't give you the full effort. And this is especially happening when you have to pay as an author. So I think I would say be more. If it's a good offer, look at the offer, but I would say it's this offer is not for you, it's for the article, it's for making money. So in this respect, I would be a bit careful about how to deal with that. But if it's decent and you have they recommend a very similar article, or they give you, let's say it that way, if there's something they say this would better fit into this journal, and there's an argument, and it's not just filling inferior journals with a low impact factor or no impact factor, then that would be a bit of a problem. But if it's, I think I would discuss it. I would discuss it with my colleagues and see what they think about that. And I would say, where do I stand myself, and what's the best thing for my paper?
Another question that is very specific to Global Psychiatry Archives this is question by Basma, Dr. Basma. Is submission to Global Psychiatry Archives free for middle income and low income countries?
I think let's say it that way. I think we can waive the. I think let's say it that way. What we say we in our journal, we try to help people. So my view was, I'm quite good at editing journal. I'm quite good as a publisher. And when I was working with European Psychiatry, at some point in time, there happened something which I find very difficult. That the organization, the European Psychiatric Association, wanted to publish papers which had a very low quality into European psychiatrists, and we had discussions about that. And this was 2018, and then there were some discussions about how to deal with these problems. I think this is where I developed this concept that we can, have a global approach to things, and we can develop something where I think people are underrepresented. And one of the things where people are underrepresented is they very often haven't got the guidance to write a good paper. And some people, we have people from Iran who didn't have sufficient support. And in the meantime, from a very mediocre or whatever low paper, this author now has very good papers, and recently wrote a paper in Lancet. So I think my intention would be also to help people who more or less come from less privileged countries, and I think that's the other thing, where we can get information like flooding or binge drinking in Ghana. So I think that's issues which I think are very important. But no, we can more or less waive the fees. That's not a problem at the moment. Yeah, I think that's not a problem. I think we would like to support people. However, we can't make compromises on the quality. So more or less, very, very often, we go to 2-3 reviews, simply because I think sometimes it's a learning experience for young colleagues to improve their journal, their articles. And this is a learning experience for myself as an editor. Then I have to push the authors and the teams more to be involved together into in writing papers, and not just leave it on the person with the least experience. I hope this helps, this information. If I haven't been clear enough, just tell me.
We have another 2 or 3 questions. The question is by Dr. Rasmi Srivastav. So how do we measure quality of evidence? So can you just elaborate it on?
Right. Okay. So I think there are some, let's say the AMSTA criteria is very, if you look at AMSTA, sometimes you can have these quality assessments tools like AMSTA quality. So I think quality can be measured, whether it's difficult. It's difficult. The question is, I think these tools are made for something which more or less are structured, very structured papers. I think it's more or less what we learned, that you have the argumentation which starts from the beginning, from the idea, explaining everything and matching the data analysis with the hypothesis, and then fitting the hypothesis and discussing what you wanted to do. I think so it's more or less, do you have a consistent point? Can you prove every aspect of your can you prove evidence for every step in your logic and in your data analysis? But that's more or less the quality. There are tools. I think the Joanne Briggs Institute, they have tools which I recommend. But if you're not into these formal criteria, then you can certainly see, is my story consistent? Where can critique be seen? And where are the limitations? But I think even if you have a paper which has limitations, if you tell them and if you make them clear and you're honest about that, then the quality of the paper is still high. But yeah, quality is something which is very different. But I would say, is there a logic and consistent, proven, evidence-based chain of proof and evidence? Okay.
We have one last question. That is there any specific journal that will recommend for publication of systematic reviews?
I would say, I'm selfish, Global Psychiatry Archives, that's the one. I think we do very well. I think we have done very good articles. I think systematic reviews also have, they're usually quite good. I think they're underestimated. They're usually very often seen as the last experience, but it can be a good start, because I've seen if we do a systematic review about whatever, soccer in mental health or Ramadan in mental health, when you do this, you see very, very easily where the lack of research is. And if you do this properly, you have written half of your grant proposal, because you know the literature, you know what's lacking. And that's where I think the quality of a systematic review comes in. The introduction is already nearly written. You've shown already that you can publish something. So I'd say the value of systematic reviews can be very high when you just when you start from writing something. And we value these papers. I think there are other journals which value them as well. So yeah, I'd be selfish enough to recommend Global Psychiatry Archives. And we have quite a few systematic reviews. Okay.
Thank you so much, Professor Renner. It was quite enriching presentation and quite long presentation, so that it elaborated every aspect of how to write an article, to how to approach for publication, what are the common challenges from the perspective of an editor, from the perspective of a reviewer, from the perspective of a reader, to a perspective of an author. So it's more of a complete presentation. I hope the participants must have learned a lot from this presentation. Thank you so much for giving your valuable time for this presentation. I hope in near future, if you get such opportunity, will take your help to organize similar kind of activities for a larger audience. Thank you so much. Over to Professor Hardeep Malhotra, who is the Dean of Research Cell, King George's Medical University. Sir has joined. So over to you, Dr. Hardeep, sir, for the vote of thanks.
Thank you, Dr. Sujit. And Professor Rainer, good morning. And my apologies for the last minute. I was told for an urgent matter. So I've been into the much of your part of your presentation. It was really nice. And on behalf of the entire medical affairs and research team at King Gerorge's Medical University, I extend my heartfelt appreciation for delivering the lecture, providing excellent insights into, especially what should be done, what should not be done. And it was really a great overview, ranging from the basics of writing through authorship and disclosure issues to publication as such. So I also thank all the participants from India and abroad who have joined, attended this webinar, and we believe that this lecture would help them write succinctly and avoid procedural delays involving in the publication process. So any last minute thoughts from Professor Reiner? We'd like to have them before we close this webinar. Sir.
I'm very, very grateful for just coming up with the idea. I'm very grateful for Sujit Kar, who invited me and convinced me. And yeah, thanks for all the listeners and taking time on this Saturday. Thanks so much.
Thank you, everyone, and have a nice